Thank you for joining us today, and especially thank you to Seth Groff, who has taken time out to join us and go over selling senior ancillaries year round. We really appreciate all of the insight that Seth brings and his willingness to always be a resource to us. Just so everyone knows, the attendees' phones are muted, but if you have any questions or comments, please throw those into the Q&A or chat box. There will be a portion at the end of the presentation where we will address those questions and provide answers to you. Just so you know, this presentation is being recorded for access later so that you can review and use this as a resource. Just a reminder, we have lots of tools for our agents in our agent toolkit. You can access those on our website at www.cornerstoneseniormarketing.com. Some of these tools include our social media and website services, Broker Resource Center, Medicare Center, CSG quoting tool, discount mailers, direct leads program, discount drug app, the T65 app, and many others. If you have any questions about any of these resources or tools, please don't hesitate to reach out to myself, your sales director, or your service rep. And with that, I am going to pass this over to Seth. Seth, are you ready to start sharing your screen?
I am ready.
Perfect. I'll stop mine.
All right. Well, thanks everyone for jumping on today's call, and thanks for all the great folks over there at Cornerstone for giving me this opportunity. I'm really excited for today's call. We started the second quarter of 2021, I think 14 days ago. And I always say that the second quarter of the year is the best time to start really honing in on ancillary products, getting up to speed with them, and just preparing to sell them not only throughout the rest of the remainder of the year, but really ramping up for when AEP opens up. Because before we know it, we'll be in third quarter, then fourth quarter, and then we'll be learning the new Medicare products that come out. And so really right now, second quarter, April, May, June, we got some downtime. Now's a great time to learn about ancillary products. Go back to our clients that we sold in during AEP during 2020, talk to them about these products, and just get ready to really hit the ground running once fourth quarter comes, because I'm telling you, it'll be here before we know it. As Michelle mentioned, I'm Seth Groff, sales director with SureBridge. If you're not familiar with SureBridge, I always like to point out the name. You're going to see that it's SureBridge, underwritten by the Chesapeake Life Insurance Company. SureBridge is just the marketing name. The Chesapeake Life Insurance Company is the actual paper that it's on. But I always tell people that we're one of the fastest growing ancillary carriers in the marketplace. And really, here is how we're doing it. Our goal is to offer some of the best products at the best price and compensate you very well for selling these products. And the only way we can accomplish all three of those things is by leveraging technology. And so in 2020, we issued over 280,000 policies, and our underwriting team consists of basically 2 people. And so the only way we can do that is to leverage technology. So everything's going to be quoted and applied for via point of sale tool online. There's going to be several different signature options available. You can do face-to-face if you're meeting with the client. You can do email, you can do voice signature, you can even do text signature if you're selling over the phone. And so we're going to make it as convenient as possible for you to enroll your clients in these ancillary products. Also, when you look at our plans, we got a broad portfolio of ancillary products. So, we can be your go-to ancillary carrier. But when you're looking through our products, you're going to see guaranteed issue plans and then true simplified issue plans. When I say guaranteed issue, that means there are going to be no health questions on the application. Answer a few qualifying questions, and then that client's going to be good to go. When we're looking at the true simplified underwriting products, like our hospital indemnity plan, which we'll talk about today, there's going to be some, we're just going to use the application for the underwriting process. So as long as you can get through the questions favorably and truthfully, those policies are going to get issued. But the point of this slide is just remember, we're going to make it as easy as possible to enroll your clients. And these plans are going to be issued very quickly. Over 90% of the time, they're issued in real time. So really the only reason they wouldn't be issued in real time is if for some reason they were going to be a decline, or if the client already has a policy with SureBridge and for some reason it gets kicked out. So when we look at our portfolio, we got a full portfolio of products in both the under 65 and over 65 market. Really today, we're kind of focusing on the over 65 ancillary sales. And when we talk about the over 65 ancillary sales, you're going to look at prime DVH down here, or the standalone dental or standalone vision, and then hospital wise, which we're also going to talk about today. And then actually our critical illness goes out to age 90 as well, which we won't talk about that particularly today, but that's going to be another product that you can sell in the over 65 market. Remember, with ancillary sales, they can be sold year round. And so you don't have to wait till AEP or some other qualifying event. These can be sold year round to your client, whether you're working that over 65 market or under 65 market. And when you contract with SureBridge, you get access to all of these up here on the screen, which is nice. So maybe you're still on the fence about why selling ancillary products. I'm sure you're probably successful, making a good living, selling some type of core medical plan, whether it's Med Advantage or Med Sups. So why sell ancillary? Why take the time? Well, first of all, client retention, right? There's a lot of studies out there that show the more products a client purchases from you, the less likely they will leave you to go to your competition. And, the example that I always use for that is property and casualty insurance. With my property and casualty guy, I have my house, I have all of our cars, I have my motorcycle, I have our boat. And so it's just too much work to unwind all that. And so I'm probably going to stay with that guy because he has enrolled me in multiple products. And so the same is true even in the over 65 market. If you get a Med Sup and then a Prime DVH, the chances that client leaves you are just going to be a lot less. Then also differentiation from your competitors. You would be surprised of how many presentations I give. And I ask the question, how many of you are selling ancillary products? And not very many hands usually go up in the crowd. And so there's a lot of agents out there that are selling senior products that aren't talking about ancillary products. And so, when you look at the core products, whether it's Med Sup or Med Advantage plans, chances are your competitors have the same access to those same carriers, right? When you talk about the big boy carriers for those core senior products, most people are going to have the same access. So how are you going to differentiate yourself? Well, showing them ideas and concepts that might help them pay for some of the out-of-pocket costs not covered by those plans is a way to differentiate you from your competitors. Then additional income. We're in this to help people, but we're also in this to make money. And this is a pretty conservative estimate that I always give. But if you sell one ancillary product per week, you're going to increase your income by, $10,000 approximately. Obviously, there's a lot of things that factor into that, the size of the policies, commission schedule, et cetera. But just a general rule of thumb, if you sell one per week, you're going to see an increase of $10,000. And I don't know if that seems like a lot or not, but what I always say is, if you're making $100,000 a year, by increasing your income by $10,000, that's a 10% raise on your annual income. So that's always going to be good. And so you do the math from there. What would it do if you did 2 per week or 3 per week? So look at the number of clients that you sell throughout the year and just start talking about ancillary. And it's a great way to increase your revenue per client. Then finally, your clients need them, right? These products that we're going to talk about, there's a legitimate need for them in that senior market. We'll kind of talk about that on the future slides. And so they need them. They're looking for them. You can be the person that goes out, educates them on how to enroll in them, the advantages of them, and then you'll get compensated for all your hard work. So it's a win-win-win for everyone involved. Now, when we're looking today in the senior market about selling product or ancillary products year round, we're going to talk about 2 products. And this slide just kind of shows, which one you should be focusing on. And if you're selling Med Sups, usually I say focus on Prime DVH, which is a dental, vision, hearing plan. If you're primarily selling Med Advantage plans, I would say focus on hospital wise, because that'll help cover some of the out-of-pocket responsibilities associated with that MA plan. And if you're selling both based on the needs of the client, great. great. Pay attention to both because you're going to be able to use both of them when you're out talking to your clients. So the first one we're going to take a look at is Prime DVH. And remember that DVH stands for dental, vision, hearing. And so this is going to be a combo product that's going to give your clients benefits for all three types of services. And when we talk about the opportunity for this, this slide really stands out to me because you can see up there, most people on Medicare do not have dental coverage and many go without care. So, out of all the people on Medicare, 65% don't have dental coverage. And so I always just use the example, if there's three people here, it's Michelle, me, and you are standing there and we're all in that Medicare age. Chances are two of us don't have dental coverage. And so just the opportunity to go out and talk about Prime DVH is just tremendous because statistically, this population doesn't have dental care, even though they're at an age where they really need to focus on their dental care because their teeth might be deteriorating just due to their age. And so the opportunity out there is tremendous if you're just willing to go out and talk to people about the advantages of routine visits to the dentist and using a dental insurance as a more cost-effective way to pay for those services. Also, some people say, well, and, I said on a previous slide that if you're selling Med Advantage plans, focus on hospital indemnity, but there's still an opportunity for dental DVH as well. Because I know that there's a lot of MA plans out there that have dental coverage in them. Okay. And usually when I, talk to an MA focused agent, they're like, no, my plans have dental coverage. But then it's like, I asked the question, do all of the plans you sell do? Because statistically, only 42% have extensive benefits, okay? And so 40% of MA plans don't have any dental coverage, so obviously they would be a good fit for this plan. And then 19% only have preventative benefits. And our plan doesn't coordinate, so even if they have basic cleanings with their MA plan, but they want, some protection against some, more major stuff like crowns or root canals, you could actually sell them both if it makes sense for the client. And our plans don't coordinate. So even if the MA plan covered it, they would still be able to submit a claim with SureBridge and get paid with our plan as well. So just always like throw that out there because a lot of times the agent says, no, I sell MA plans and they have dental benefits. And I always just ask the question, what kind of dental benefits? Because let's really take a dive in there and see if it's really meeting the needs that your client wants and with their dental care. So Prime DVH, dental, vision, hearing combo product. And, when we designed this product, we went out into the marketplace and we looked at the other DVH plans and we said, okay, what do we like about them? And then what don't we like? And one of the things we didn't like about the other DVH plans out in the marketplace is the preventative dental services. So a lot of the other competitors that you get hit with a deductible and then it's not covered at 100%. So that, client goes get a cleaning and they get a big bill and they're like, hey, I don't see the point of this. But with Prime DVH, our preventative dental is covered at 100% from day one with no deductible. So you can go, you buy this plan, you pay your first month's premium, you go to the dentist, you get that, exam, they do some basic x-rays and they do that cleaning, no out-of-pocket costs, okay? No, covered from day one, no deductible, covered at 100%. Also, the vision and hearing exams are covered at 100% from day one and no deductible. So again, you can go to the dentist, get your teeth checked out. You can go to the optometrist and get your eyes checked out. You can go to the audiologist and get your hearing checked. No out-of-pocket costs, no deductible. So when we talk about true value, that's immediate value that they can go get with this plan after literally paying 1 month's premium, which is going to be nice. Looking at the other dental services out there, your basic, so your cavity is going to be, there's no waiting period for that. So you go get your teeth cleaned, they say, hey, you have a cavity, you're going to be able to get some coverage for that. We'll talk about what will actually be covered on another slide. And then even for the major services, so again, that's like a root canal or a crown that does have a 9-month wait, but very competitive when you look at it in the marketplace. You're going to see competitive premiums and commissions, and then also the insured can either take some advantage of some savings with the networks we have tied to this plan, or there's actually some pretty good out-of-network benefits as well. And we'll talk about how those work here on a couple of slides. So looking at this plan, issue ages 0 to 90. Okay. So, and it's guaranteed, or it's renewable for life. So as long as, you get it enrolled in it before you turn 91, this plan, they get to keep it. So that's going to be nice. These are going to be individual policies. One thing I do point out is that we actually do allow child primaries with this plan. And so if you're writing in the under 65 market and you have somebody that just wants to get this plan on their child, or maybe you're talking with the grandparent, they say, hey, my kid needs some dental coverage as well, or not my kid, but my grandkid, they could purchase that as well. Guaranteed issue, no health questions. Basically, there's a couple knockout questions, have to be in the United States legally, and then also have to, you can't be incarcerated. As long as those two things, it's going to be guaranteed issue. The way that it works is that you select a pool of money. So you either select $1,000 benefit, $1,500 benefit, or $2,000 benefit. And all types of services are going to come out of that pool of money. So that's not just for the dental. Your vision benefits will come out of that. Also, your hearing benefits will come out of that as well. So you select the pool of money, and then that's going to be used for all three types of services. There is going to be a $100 deductible for some services, and I'll talk about which ones that is applicable to. But however, remember the preventative stuff, the preventative dental, the vision and hearing exams, that's not applicable. And again, we'll talk about the actual networks on some upcoming slides. Up on the screen here are just going to show some basic dental benefits. This is not an exhaustive list. What I always tell people is to go out, download the product guide. Okay, so once you get contracted, you can go out to our agent portal, download the product guide, and then you can actually access sample policies. The sample policy lists everything that's covered, what category it falls into, and then when somebody asks the questions, is XYZ covered, you can always come back and look at that sample policy. The two that I always point out here are going to be implants. They are not covered. So inevitably someone will ask me that question if implants are covered. And then the other thing that everyone always asks is about orthodontics, not so much in the over 65, but definitely in the under 65, and orthodontics aren't covered. So implants not covered, orthodontics not covered. Other than that, it's going to be a pretty standard dental plan as far as what's covered. But for the exhaustive list, always access the sample policy that can be accessed through the policy guide. Product guide, it's going to be a great resource for you. So here's how the dental benefits work. Okay. So we already hit on the preventative. There's no waiting period. It's covered at 100% and the deductible is not applicable. Your basic type services. So that's going to be your basic cavity. Again, no waiting period. It's going to be covered at 60% year 1, 70% year 2, and 80% year 3 and beyond. And the deductible is going to be applicable for that. For your major services like a crown, you're going to have that 9-month wait, but then the remaining 3 months, it's going to be covered at 60%. Year 2, it's going to be covered at 70%. And year 3 and beyond, it's covered at 80%, and the deductible is applicable to that plan. Now, remember, it's only one deductible per policy, so if you hit it for the basics type services, you don't get hit again. It's only going to be one time. Now, this is how the policy is going to pay if you go in-network, okay? And for in-network, we use the Carrington Network. And the Carrington Network has a wide range of providers across the United States. I'll even show you how to go out and look up providers on an upcoming slide. But whenever possible, go to a Carrington provider because there's already pre-negotiated rates, and it's just usually ends up being a better deal for the client. But there's probably somebody on this call today that's saying, well, Seth, that's great, but I have a client that, they've been going to the same dentist for the past 50 years. They don't take any insurance, and they're not in network. So how would this plan work? Okay, so we use what's called a passive network for non-network providers. And the way that works is that it will actually pay the same percentage, okay? So up on the screen there, it'll actually pay the same percentage. However, the maximum that we will pay is going to be based on the 75th percentile of usual and customary charges. Now, this is where I usually lose people, okay? It's not 75% of usual and customary. It's the 75th percentile of usual and customary charges. And so the way that I explain it is imagine that there's 100 dentists standing in a line and they all charge a different amount. And, if you go to dentist 1 through 75, you're golden. It's going to pay the same as if you went in network. However, if your dentist is, in the upper quartile as far as most expensive, so you go to dentist 76 through 100, it's going to be capped at what that 75th dentist charges. So if he charged $100, but your dentist charged $200, that 60% would just be applied to the what that 75th dentist charged in the area. So that's how the out-of-network works. We actually have a flyer for it. So if you want to take a look at that flyer to get a better explanation than that, you can. But again, whenever possible, go to the Carrington Network. It usually just works out better for the client due to the discounts associated with that plan. So that's how the dental benefits work. Now we'll kind of jump over and take a look at the vision and hearing benefits. So when we look at the hearing benefits, you're going to get your hearing exam. It'll help purchase hearing aids, repairs to the hearing aids, and this uses the True Hearing Network. And one of the things that get clients the most excited about the hearing benefit is that True Hearing Network, because you're going to see on the next slide, the benefit's $500 every 2 years. However, when you're out buying, $6,000 hearing aids or $5,000 hearing aids, that doesn't get you very far. However, if you throw on there a 50% discount, now you're talking about some pretty significant savings through this plan, in addition to the benefit tied to it. So True Hearing, again, huge network across the nation. Whenever possible, go to a True Hearing provider because I'm telling you, you can get some pretty legit discounts by going in network to that True Hearing provider. Now, the vision benefits are not tied to a network, okay? Vision benefits are not tied to a network. I'm going to reinforce that multiple times through here because there always is a little bit of confusion on that. The way the vision benefit works is they go out, they see any provider they want, they would settle up with that provider, and then they would submit the claim directly to SureBridge, okay? So the vision benefit will always be a reimbursement, but it's going to cover eye exams, frames, lenses, contact lenses, etc. But just remember that it is not tied to a network. The client would settle up with that provider, then the client would submit the claim for reimbursement back to SureBridge. But here's the way that it works. What I want to point out here is that the vision benefit is capped at $200 a year. Okay, so even if you have that $2,000 benefit, only $200 a year can be allocated towards the vision benefit. Exam covered immediately, no deductible. Keep in mind that the hardware does have a 9-month wait on it, okay? And then it's going to be covered at 60, 70, and 80%, and that deductible is applicable. With the hearing, it's going to be a $500 benefit every 2 years. The reason we designed it that way is because people don't buy hearing aids every year. And so, when they have to go make that big purchase, they get $500, or they can do $250 or split it up any ways they want, but then wait 2 years and they'll get that full benefit back again. But again, hearing exam covered, the hardware does have a 9-month wait, then covered at 60, 70, and 80%. And that deductible is going to be applicable. But remember, there's only one deductible per policy, per plan, or per person, per plan. And so if they already hit it on the dental, they don't have to hit it again, but that's how the benefit's going to work. Now, they can use the entire, remember the benefit, $1,000, $1,500, or $2,000. They can use it all for dental, but they will be, subject to these caps on the vision benefits. So keep that in mind. But that's how the vision benefits work, and the hearing benefits. And, in conjunction with the dental benefits, we've got a pretty competitive Prime DVH plan for you and your clients with this plan. Now, up on the screen are just going to be some sample rates. These are going to be the generic rates. Always double check the rates because there are some state-specific rates. But the thing that I always like to point out on this slide is, number one, these are issue age premiums. So there is an incentive to get these, issued, especially when you're turning 65, because as soon as you turn 66, you jump up in the age bracket. But if you purchase this at 65, you get to continue to pay that 65-year-old rate. And so you get it locked in at $36. You pay $36 for the remainder of the policy, unless for some reason, we had to go back and refile the product. But you're always going to pay that 65-year-old rate. So, some real good incentive if you're working that turn in 65 market. The other thing I always point out is about upgrading benefits. So people always say, well, how can I upgrade? We only allow upgrades on the policy anniversary. Okay. So if they have $1,000 benefit, then they want to jump it up to $1,500. You only can do that on the policy anniversary. So keep that in mind. They don't start waiting periods over but they have to do it on their policy anniversary. So that's kind of how that works. A couple of FAQs, will your client receive an ID card? If you're working in that over 65 market, they will always receive an ID card in the mail, okay? If they're in the under 65 market, it depends on a question on the application. There's a question on the application that says, do you consent to electronic delivery? If that individual consents to electronic delivery, they will not receive a card in the mail. They will just receive an email with instructions on how to download that card. So my recommendation is to just always answer that question on the application. No, do not consent to electronic delivery. And then your client will always receive an ID card in the mail. How to find a provider. I always go out to ChesapeakePlus.com, and then right down here in the lower right-hand corner, you can see it says find a dental provider and find a hearing provider. Do not get confused by this find a vision provider. This is for a standalone vision plan. As I mentioned on an earlier slide, the vision benefit on Prime DVH is not tied to a network, okay? And so that is not applicable for the Prime DVH. But you can look up your dental providers and your hearing providers. Also, you can see right here, you can actually help your client get an ID card. You don't have to register on this website. You can come out here, click on get an ID card, and actually you, the agent, if you have their policy number, can get their ID card as well. And so right there's where you go to get an ID card. Also some other good stuff you can do there, like changing contact information for your client, requesting a duplicate policy print, or even canceling your policy. So a great website to write down and keep handy, because you can do a lot of stuff right here at ChesapeakePlus.com. When your client goes to the dentist, make sure they are saying Carrington, okay? If they say SureBridge or the Chesapeake Life Insurance Company, they probably won't know who that is. They'll be familiar with Carrington, and again, that's who the network is tied to. So always say Carrington. If they go to the audiologist, be sure to say True Hearing. And again, if they're going, for the vision benefit, I tell people don't even show your card, because again, that it's not going to coordinate benefits. The client actually has to submit the vision claim as a reimbursement. Will the dentist file the claim? Yes. If you go in network, the dentist will file the claim. Same with True Hearing. If you go to a True Hearing provider, they'll file the claim for the client. The vision, again, this is like the fourth time I've said it, but vision will always be reimbursement. And so don't get confused with that one. The number one sales tip that I have for you selling in the over 65 market is to leverage the Medicare and You handbook. If you flip to this page, I think it's on page 57 or 59 of the Medicare and You handbook. It says right here what's not covered by Part A and Part B. And if you scroll down, it says you can get maybe some of these services with an MA plan, but if you stick with, Part A and Part B and Med Sups, most dental care are not covered, eye exams, dentures, and hearing aids and exams for fitting them. And so you just point this out to the client and just say, hey, look, I got a cost-effective way to pay for this care. I'd like to talk to you about Prime DVH, which is a dental, vision, and hearing combo product that will provide you some insurance to get these in case you don't want to pay for them out of pocket costs. So just leverage the Medicare and You handbook. Almost everyone has this sitting on their coffee table if they're turning 65 or they're familiar with it. And so flip to this page. Again, I think it's 57 or 59. But flip to this page and just say, hey, look, these things aren't covered with A and B. Let's talk about how we can protect you against the risks associated with these with using Prime DVH. Otherwise, another great sales idea is just ask the question, are you currently going to the dentist? Because regardless of how they answer this question, chances are you'll be able to have a conversation. So if they come back and say, no, I'm not currently going to the dentist, you say, okay, is that something you're interested in? Chances are they'll say, yeah, I probably should go to the dentist. You say, great, let me show you a cost-effective way to pay for your dental care. Okay. If you ask this question, are you currently going to the dentist? And they come back and they say, yeah, I am going to the dentist. You say, great. Are you paying for that out of pocket, or are you using insurance? And if they come back and say, well, I'm paying for it out of pocket, you go, oh, well, let me show you a more cost-effective way to pay for your dental care. If they come back and after you ask, are they currently going to the dentist? And they say, yeah. And you say, well, are you using insurance or paying for it out of pocket? Then they come back and say, well, we actually have insurance. You say, oh, great. Well, just out of curiosity, does it also include vision and hearing benefits. Chances are it doesn't. And then you have an opening to talk about Prime DVH to see if it's a better option for their client so that they can get some hearing and vision benefits in addition to their dental plan. So I always say, ask that question, because regardless of how they answer, you're going to be able to pivot and have some good conversations. Also, the other thing I always tell people is know your numbers. I went out to this website, typed in my zip code here in Nebraska, and these are all covered under the preventative type services, so no out-of-pocket costs. And you can go out day one, get these services. That's $303 of value. And so when you look at dental insurance, some people say I don't see the point because you're only insuring against $1,000 or $1,500 or $2,000, which is true. But if you're using it, which if you buy this plan, use the preventative services, I can go out day one, get $303 worth of preventative. Now, if you throw on, a second cleaning throughout the year, and then you go get your eyes checked and get some, glasses after 9 months and get your hearing checked, now you're probably going to end up with more value than what you paid in premiums. And so, then you also have the additional protection in case something serious happens and you need some serious dental work. So I just always say, know your numbers. Another thing a lot of agents do, they'll just buy it on themselves, go get that basic cleaning, and then show their clients the bill and say, look, here's what the dentist in our area charged me, and I didn't have any out-of-pocket costs for this basic cleaning. So another great strategy for that. So that's Prime DVH. Again, it's one of our fastest growing products. And I'm telling you, if there is one product I would say to start with, if you're not familiar with ancillary sales and you're not sure where to get started, start with Prime DVH, because most people are familiar with dental insurance, right? They probably have it through work, but then they turn 65 and they, leave their job, say they lose their group coverage and they don't know what to do. And so there's just a huge opportunity for it. So if there's one product that I say start with Prime DVH. It's just the easiest to learn and talk about, and clients are familiar with it and want it. Now, the next product I'm going to talk about is HospitalWise, which is going to be a hospital indemnity plan that can be sold in conjunction with Medicare Advantage plans. And this, works well in the senior market as well. Most of the time people are going to Medicare Advantage plans because of the cost savings. However, with those cost savings, there's going to be some additional out-of-pocket responsibilities. And, again, there's more and more people who continue to enroll in MA plans. So there's plenty of people out there to talk about this concept. The out-of-pocket limit, the average is, $5,000 for in-network services. If you're talking to seniors that work on live on a month-to-month only Social Security income, it can be tough to write a check for $5,000, but they might be able to afford $40 a month or $50 a month for a hospital indemnity plan to help cover some of these out-of-pocket costs that they get hit with. So it just might be a cost-effective way to help protect against that risk. And then, when you end up in the hospital, even though there's going to be some limits for their exposure, you're going to probably walk out of there with a big bill. So definitely a need for this with these plans. So here's going to be the basics of it. Again, issue ages 0 to 90. This product is going to be simplified underwriting. So there are health questions. However, as long as you can answer the health questions on the app favorably, it's going to get issued. There's no MIB, no script check, no phone interview. So it's going to be nice. You can look at the rate structure. You can do it individual and spouse. This does have a pre-existing condition clause, which has a 6-month look back period for the first 6 months of the policy. So if you've been treated or diagnosed for anything 6 months leading up to the plan, you're not going to be covered for the first 6 months of the plan. So for example, let's say you had, let's say you sprained your ankle, right? And then, 5 months before you buy this plan, and then you break it again, and you end up in the hospital because it gets infected, and it's not 6 months out, that wouldn't be covered. But other than that 6 months look back for the first 6 months of the policy, you're good to go. And there's no waiting period for, sickness or accidents that aren't fall subject to that pre-existing condition clause. This particular plan does have a $20 application fee. Prime DVH does not, but that $20 app fee, it's just one app fee per application. So if you're enrolling a husband and wife, they only get hit for one. Or if you're enrolling multiple products, so like for some reason a DVH and a HospitalWise, it's only one as well. So keep that in mind with your clients, because $20 will be added to the first month's premium. But the way that it works is the first part is you select a benefit amount. And so you can select a daily benefit anywhere from $50 to $1,000 a day. I'm going to show you how to dial that in to align with the copay associated with an MA plan. So you're probably going to be looking at $200, $300, $400 a day to really align with that. But if you're in the under 65 market, we see some $1,000 a day. After you select the daily benefit, you can select the benefit period. You see 3, 6, 10, 21, 180, 365. And, we can dial that in again with their copay days. And so we see a lot of 6-day benefits, to kind of align with if they have 5 days or 6 days of copays. So that's the first part. You select your daily benefit amount and your benefit period. Some additional benefits built into the plan is that there is an observation benefit. So as long as you hit that 12th hour of observation, it's going to pay just the same as if you were actually confined to a hospital. A lot of times doctors are hesitant to admit people to the hospital, so they keep them for observation. As long as you hit that 12th hour, you'd get your daily benefit, which is going to be nice. Also, mental nervous benefit pays up to $250 a day for a maximum of 7 days per year if you're confined due to a mental or nervous disorder, where a lot of our competitors actually do not cover mental nervous issues. So again, another nice benefit. After you select the daily benefit amount and benefit period, then you can start taking a look at riders. I'll really put a highlight on the ones that you'll probably use selling in conjunction with an MA plan, since we are talking about this, kind of in that senior market. The lump sum hospital confinement rider, that's primarily sold in the under 65 market. It just pays that the first time they're confined in the hospital. So, kind of help pay with what their deductible is, but not necessary for the over 65 market. We'll show you how to kind of structure this plan in conjunction with the MA plan. However, the outpatient surgery rider is going to be one you want to take a look at. Pays that benefit twice per year for outpatient surgeries resulting from sickness or injury. So a lot of times, a lot of the surgeries, you're not actually admitted to a hospital. And so that'll, help cover the copay associated with it. Skilled nursing facility rider is, again, going to be one that you're going to add. A lot of MA plans cover them days 1 through 20. And so we can align this benefit and select the 21 through 100 day benefit period to align with that MA plan and what their copays are. Emergency care rider. This is a real popular one. Pays that benefit of $100 to $500 4 times a year if they go to the emergency room due to sickness or injury. It does have to be an ER tied to a hospital, okay? So it does have to be an ER room, but they don't have to be hospitalized, okay? And so, again, another huge advantage. A lot of the other plans, you go to the ER, you only get that benefit if you end up in the hospital. Ours, you go to the ER because you need stitches, you get that benefit. Ambulance rider, again, is probably going to be one you add because there will be a copay associated with the ambulance ride. Pays that benefit if you take a ride in the ambulance. And outpatient major diagnostic rider is also going to be one you want to take a look at. A lot of times with the MA plans, just pays that benefit for the CT, MRI, PT, CTA, EEG, and EKG. So that's going to be one you want to add as well. Wellness rider, probably not one you look at in the senior market, but it pays that benefit if you go out and do any of those tests. But I don't add it. It just increases the cost too much, and you kind of exchange some dollars. So not typically one that I add, but really here's how you sell it in the over 65 market. So over on the left is going to be a Med Advantage plan, very common with the numbers. You're looking at $285 copay for 5 days for hospitalization, outpatient surgery copay, emergency care copay, ambulance copay, skilled nursing. You can see $175 for days 21 through 100. And then there's 20% coinsurance for that major diagnostic exam. And then over on the right-hand side, you can see that we did $300 a day, daily benefit for 6 days. We did the outpatient surgery rider, lined that up pretty good. Emergency care rider, we did a little bit more than the $80. We actually did $200, but you can see how inexpensive it is, and they get the full $200. Okay, so remember that this plan does not coordinate with this. It will actually pay, like even in this example, if they're confined in the hospital for that 6th day, even though their MA plan covers it, the hospital-wise will also pay. And then the skilled nursing rider, we lined that up $200 a day for days 21 through 100, and major diagnostic rider $200. And we were able to, fill these gaps for basically $54.04 a month. Now, From a premium perspective, I always tell people try to keep it, under $60. It really depends on your client. Maybe you need to keep it more down around $30, $40. We see a lot, 40, 50, but you can make it much higher than $55, $60. It just kind of gets out of a lot of seniors' budgets. So I always say something is better than nothing. And so, maybe you do, instead of doing $300 a day, you only do $250. And so you're not protecting all of it. They'd still, have $35 a day, but $35 a day is going to be better than $285. So maybe you do that, or maybe you dial down and only do a 3-day benefit. So there's a lot of levers you can pull to keep these, cost effective and align with something that fits in their budget. Because again, it doesn't do anybody good if they can't afford to pay it, because they're going to cancel it and not have any coverage. So always make sure that it fits into their budget. But remember, something is better than nothing. And so if you have to dial down some of these benefits, do that. We actually have a tool available out in our illustration software. It's called Hospital-Wise Senior Plan Builder. And when you go out on our online tool and click on this, it will actually allow you to bring up the plan and then make the recommendation. And so here in Nebraska, this is an old slide. This is from 2020. The 2021 plans are out there, obviously, but you can go out there, pull it up. It'll show you what the copays are, and then it'll make a recommendation. And there's actually a button down here now that you can say quote, and then jump back into the quoting tool, and it'll actually quote the plan for you. And so we make it as easy as possible for you to do that. And if there's one sales idea that you remember from this, use this tool. Just print it off, bring it up with the client, whatever the case might be, but say, hey, here's the MA plan we're enrolling you in, and here's a recommendation to help cover those costs. And here's what it's what it's going to cost you out of pocket. If you do that, use this tool, you're going to sell a lot of these hospital indemnity plans. Up on the screen there are going to be the summary and knockout questions. There are the look back period. These are going to be treated or diagnosed. And so these would be what would be the knockouts. If it's not listed here, they would be good to go. This can be used as a cheat sheet. Otherwise, I always tell people just use the application, read through the questions. That's going to tell you whether or not they qualify, because all the health questions are knockout. And so if they can't answer it favorably, they're going to be a decline. The last 4 sales tip, the number 1 is utilize the hospital senior plan builder. Okay. Use that tool. Show them the responsibility, show them the solution. Okay. You're showing them the problem, showing them the solution. It works great. Number 2, customize a plan. Okay. Pull up the MA plan you're selling. Don't try to do a one size fits all. Really dial that in to not only what they need covered, but then also their budget, which goes to sales tip number 3, keep the premiums within their budget. Again, I see $40 to $55 kind of being that sweet spot. Unfortunately, sometimes if you go out and you quote everything, it might be $55, $60, which if they can afford it, great. But just remember, keep it within their budget. And then finally, be ready to pivot. Look at yourself, not as a sales guy, but just as an educator, educating them on what their responsibility is, and then a solution to have insurance to pay that. Okay. So do that. You're going to have a lot of success. So, with that, Michelle, that's what I had prepared for today. I will open it up. And if there's any questions, I'd be more than happy to answer them at this time. Do I need to stop sharing? Do you want the screen back?
Oh, no, you can leave that screen up. That's okay.
Okay.
So I didn't see any questions come in while you were speaking, but if we just want to wait a couple seconds here, and if anybody does have any questions, please just pop those into the chat box. Again, thank you so much, Seth, for taking time to go over this with us, and thank you to all of our participants for joining us. We really just appreciate all of you. So I don't see anything coming in yet. Oh, there's a question from Lainey. It says, can someone request a monthly bill rather than EFT? This is specific to a prospect.
So if they want direct bill, first of all, they have to take the initial application with either bank draft or credit card. So the initial payment always has to either be bank draft or credit card. After that, they can call in and request to be put on a direct bill. However, the shortest mode that they can do is going to be quarterly. And so they either would have to do quarterly, semi-annually, or annually. But that first payment has to be on a credit card or bank draft, but then they can call in and request to be direct bill, but it would either have to be quarterly, semi-annually, or annually.
Okay, thank you for answering that question. Anything else?
Nope. Just want to thank everyone for jumping on today's call. And like I said, now's the time to start selling ancillary products.
Yeah, absolutely. All right, thanks guys. Thanks so much. And to the participants still in here, if you have any questions, please, like I said before, don't hesitate to reach out to myself, your local sales rep, or your service rep. We're always here to help. Thanks, guys.